Hello, everyone. Good evening, all. So, I hope all are doing great. We are going to be starting with infection control class today. Okay. And the topic for today is hospital infection control, an overview for NABH and JCI, because many people keep asking, ma'am, audit is there, what to do? What to do that you will learn only when you work in the infection control team. Okay, no books can teach you exactly what you're going to do, which form you're going to fill, but an overview is very important, as in the standards, what all are the things that you have to take care of. This, if you have to cover up, it will take 2 classes. So half the things we'll cover today, and the remaining we will cover it next time whenever we have the infection control lecture. Okay, so we start with it. So summary, like in any department, whether you're working in medical department, pharmacy, nursing, infection control, there are some standards. Okay. So as you can see in this image, summary of standards. One is your infection control measures. Then you have to focus on your manual. All of you must be having an infection control manual. So if you are planning to work in the infection control team, you need to have a very good understanding about the manual and what's written in that, what are the topics covered in that. So I would suggest you all, whenever you have free time, go ahead and open the HIC manual, and mostly in the ICUs and all departments, like the crucial critical areas, the HIC manual is kept. One copy will be kept. So go through that. Okay, in case it's not there in your department, you can talk to somebody in the infection control team. Wherever it's kept, you can go through all the manual. Okay, HIC manual. Then hospital, so infection control measures are there, HIC manual is there, and biomedical waste management. These are some things that you need to focus on when it comes to NABH and JCI. So for all these audits, okay, auditor is going to check your manual, whether it's updated. Auditor is going to check what are the infection control practices that you follow, and also your biomedical waste management will be checked properly, whether the hospital is following a normal protocol. Now, what is the intent of HIC? Okay, effective infection control program, reduce infection risk to patients, visitors, and providers of care, measures and actions taken to prevent this risk, an action plan to control all the outbreaks. There can be a lot of outbreaks. What is your action plan? What you all are going to do? All that is what the intent is. Okay, in NABH and JCI. So, like if you see the first standard, okay, the hospital has an infection control manual which is periodically updated and conduct surveillance activities. Like I told you initially, you will have the manual. You might have attended or undergone an audit 2 years back. Again, when you're going to go for the next audit, there'll be some changes, some CDC guidelines that have changed, some things that you have implemented newly. So you will have to bring about the change in that. Some of you are already working as infection control microbiologists, infection control nurses. There are most of you who are attending this session. Okay. So I'm sure you must be going through the manual, and maybe one line change, but that one line change has to be updated and it has to be shown to the quality department, intimated, informed to them as well. Okay, so it focuses on adherence to standard precautions at all times. Cleanliness and general hygiene of facilities will be maintained and monitored. Cleaning and disinfection practice. So when you look at this PPT, HIC 1A, HIC 1B, HIC 1C, this is the format which will guide you as to how you have to present your data, how do you recheck whether you all are prepared for the audit. Okay, so it focuses on adherence to standard precautions. So make sure you have a standard precautions ka protocol in your SOP, I mean in your big manual. Okay, and whether if it's written, use gloves and masks during procedures when potentially infected cases are there. If the manual says something, you have to ensure it is being followed. Okay. Then second one is cleanliness and general hygiene of facilities will be maintained and monitored. Okay. So in this, what all can come? Now you all tell me. In the second point, cleanliness and general hygiene of facilities will be maintained and monitored. Now I'm teaching you how to go about. If you become chapter champion of an infection control chapters, this is the way you have to go about. Cleanliness and general hygiene of facilities. What all will come under this? Come on, tell me. Cleanliness and general hygiene of facilities will be maintained. Okay, environment, water testing, very good. Hand wash, yes. So all these points will come under that. Then housekeeping, how they're doing the cleaning and all. Okay. Then third one. Okay. 5 moments. Next is cleaning and disinfection practices are defined and monitored as appropriate. So whichever HIC nurse will have to go and check whether the housekeeping are preparing the solution properly, the disinfectant, whether the measurement is correct, equipment autoclave right. Okay, so yeah, the equipments, whether they are the CSSD department is following all the practices strictly, whether the temperature is correctly maintained, packed properly, whether the expiry is mentioned correctly, all those things. Okay, equipment cleaning, disinfection, and sterilization practices are included. That means, okay, your housekeeping is doing things correctly, mopping, duster policy, everything is there. Okay, whether they're doing it correctly also you'll have to check, and also you have to check whether it's written in a policy also, or it's just that okay, in the air you just started some policy and they are following it. Because the auditor might come and just ask the housekeeping, okay, what is this, this is this, okay, please can you show me this policy. Okay, and then he'll open your manual and then he'll check, okay, this is the duster policy, okay, this color is used here. And then he realized that the housekeeping was not using that particular color for the glass cleaning. Okay, then what will happen? There is an NC, non-compliance. This is contact time, water dilution, correct? These are the most important things that you require for your this thing. Okay, clear everybody? Everybody is able to view the PPT slide? Okay. Next is laundry and linen management processes are included. Okay, great. I'm happy that you are replying. Laundry and linen management. So basically, if there's an infected patient, post-surgical, or some of them are having infections, some of them are having contact isolation, contact precaution. Just because isolation board is there, housekeeping is just collecting everything in a red bag and sending it. Yeah, so right. They'll be just putting it in the common place. That's not right. Because the infected and non-infected laundry should be separate. Correct. So whether there's a policy also, whether the policy what is mentioned in your manual is being followed. These are the two things that you have to understand. And this is not only for HC. Okay. Any of you. So most of you must be wondering, you must be thinking, I want to work in infection control team. I want to work in quality team. I want to work in that team. Everywhere this is only going to be done. NABH has given some standards. Each department ka standards are there. Read that standard. Then you have to go back to your manual and find out if this is there, if this is being followed, if this is understood. Like for example, if the manual says monthly trainings for hand hygiene to be conducted, okay, that means what will the auditor come and check? Auditor will check your training records, whether monthly trainings are there, how much attendance is there. He'll also check your manual. Facility protocol, very, very important. All facility protocols. Okay. So this is how it works whenever you have to have an audit. Now you will wonder, oh my God, there's so much to do. How will I do it alone? This is like a teamwork. Okay. The burden doesn't come on just one person. It's divided. So normally when a team is there, the person who's having good knowledge about the standards, that person takes the lead and then she will guide each person. She or he will guide the other. So you don't need to worry. Okay. You just know that these are the way things are done. And whenever you get an opportunity to do something like this, go ahead and take it up. Okay, so laundry, linen management processes are included. Now, standard precautions, everybody knows, infection prevention practice that apply to all patients. So using your gloves, mask in general, whether infected or not infected. Okay, in any setting in which healthcare is delivered are called as standard precautions. Now, remember one thing. If you are going to mention in your manual, consider wearing mask, gloves, cap in all cases, irrespective of whether the patient is infected or not infected. And you have put the standard policy in your SOP, and the auditor comes and checks that nobody's putting cap, no use. So make sure you don't go to the extremes to make your protocols. Don't include so many things that you are not able to follow them. Minimum criteria is what you require. If you want to do something extra, make sure it's there in the policy. For example, I'll tell you one experience. What happened in one of the hospitals which I was working in before. So after there was this not COVID, there was some other outbreak. I think swine flu or something, and some infection happened, and the CEO was supposedly a doctor, and he was so frustrated. He was the owner also of the hospital, so he made a new rule. Even for IV cannulation, you need to put gloves, mask, and cap. Okay, and he, in that anger and emotions, he put that in the SOP also while IV line. Ideally, I don't think so. For an IV insertion, you need to wear gown and all this. Okay. So it became, and then when the auditor had come for the audit, he just asked, but do you require this? The nurse could not answer. Why do you require this? At least she should have answered, no? That we just wanted to be more safe, more free from infection. So we've used this standard precautions even for IV cannula insertion. She didn't answer and all. So I just feel that sometimes too many protocols are just going to have burden on your staffs. So you have to understand, reevaluate, and then decide whether this has to be done. For example, another thing is some people just use gloves, okay, and they think wearing gloves means you are sterile. So you're using your clean gloves, touch the monitor, touch the wall, touch the bed of the patient, touch everywhere. Yeah, over identification, right. Touch everywhere. And then because you have your gloves, and then you're preparing medications and giving to the patient with that same gloves. Not acceptable. Actually, in such scenario, what is happening? In such scenario, you are actually causing infection to the patient. So much better than that. I'm just giving you a substitute is don't wear gloves, go do your hand wash properly, use your hand rub, and then give injections. That is more sterile than wearing gloves, which is touching everywhere, and then you're preparing medication with that same gloves. All right. So understand the concept. When you're using gloves, that means it has to be a new gloves for medications. And then you touch the cap and Q site and all that of the IV or central line. Otherwise, you are actually going to introduce infection to your patients. Next is infection prevention practices. In that, you have hand hygiene, PPE, needle stick injury, pre and post exposure prophylaxis, environmental cleaning, safe disposal or biomedical waste, linen and laundry management, patient equipment cleaning. So, actually, when you go through this PPT, you will realize what you know that only is there in this infection audit. Okay. But what is the challenge following this? Making sure that each person follows it without a breach in the process. All right. Now, so that was the first standard. Second one, the hospital takes actions to prevent or reduce risk of hospital associated infections in patients. So in this, you have all the WAP bundle, COTI bundle, SSI bundle, CLAPSI bundle. Okay. So what is coming under that? Hand hygiene facilities in all patient care areas are accessible to healthcare providers. So what is your hospital doing for this point? Hand hygiene facilities are nowadays, yes, audit is there, but hand hygiene facilities in all patient care areas are accessible to healthcare providers. Matlab, the meaning is that you should have a hand hygiene area to do. Otherwise, there's a 20-bedded ICU and the nurse has to go and the doctor has to go all the way till the entry. No, that's why nowadays in the new hospitals and constructions, they always look at that at least between 5 patients, you should have one hand hygiene, hand wash area. Okay. So hand hygiene facility should be there everywhere. Also, the steps are reminded. That is why you see before audits, you will see nice new pictures of hand hygiene is stuck everywhere. Why? Because to meet this standard, that you need to make sure everybody is reminded, I need to do hand hygiene. Okay. And there was a funny incident. Once one nurse was being audited about hand hygiene steps. She was a fresher. She was confused. The auditor is very calm and gentle. Said, please do the hand hygiene. Yeah, when she was doing, she was asked to tell the steps. Okay. Actually, it is there in just in front of her. There's a tap, and just behind that, there's the poster of hand hygiene. She's not even looking there and she's getting scared to tell the points. So I'm just telling you, everywhere you will see hand hygiene steps, steps, steps. Okay. Auditor is not checking for all the exact steps. They're just looking at your confidence and whether you are following it. That's it. Okay. Adequate gloves, masks, soaps, and disinfectants are available everywhere. Appropriate pre and post exposure prophylaxis is provided to all concerned staff members. So that is why, see, this exposure prophylaxis, that is your needle stick ke baad wala, and also your hep B vaccines. That is why every staff, when they come, the clinical people like the doctors and the nurses, very strictly you have to take your hep B vaccines. If you have not taken it, it is the hospital responsibility that they give it to you. Even after that, people don't get remember, they don't remember their days. Like suppose you take it on one day, yeah, it's mandatory for them. You have to come, take on one day, then after 1 month they'll give you the date. It is even that also hospital responsibility, because that staff is not able to remember her own things. So that is irony. So make sure you all do all those correctly, and this record also you have to keep. Yes, 0, 1, and 6. That 6 months is what they forget. 1 month normally they don't forget. Then hand hygiene, as you can see. Then hand hygiene techniques is done using soap and water when hands are visibly soiled, and when not visibly soiled, you can use a hand rub. Facilities, basin, hand free, elbow, your solution, all these things should be there. Okay, this is something that you all already know. As you can see, certain areas which don't get covered when you do your hand hygiene. So make sure the webs and the back of the palm and all are covered when you do your hand hygiene. This is already there in your textbook. The 5 moments of hand hygiene: before, 2 befores and 3 after. Before touching patient, before cleaning, before a clean procedure or aseptic procedure. And the 3 afters are after body fluid exposure, after patient contact, and after contact with surroundings. Okay, these are the 5 moments of hand hygiene. Now, no one is asking you exam mein steps of hand hygiene. Whatever your hospital follows, just follow that. Don't ask me, ma'am, but you told me 6 points. She told me 7 points. My hospital says 8 points, 7 steps, 9 steps. Whatever your hospital is doing, just follow that. Okay. The main concept is please cover your whole hand. Okay. So hand rub, basically timing also sometimes there are differences, but in general 20 to 30 seconds is hand rub. Okay, you just did something, you just touched the patient's file, now you want to touch the patient, go and you will do a hand rub properly with the steps, and then you will go back to the patient. So that is 20 to 30 seconds. Okay, hand wash, when you're using your solution, it is 40 to 60 seconds, so almost like a minute. Okay, but surgical hand in the OT, that comes up to 2 to 5 minutes. All right. Hand washing, just the normal one which you do in the wards, ICUs, emergency department, 40 to 60 seconds. Now, hand washing competency checklist, hand audit checklist, like that you have a lot of checklists. Okay. That are the columns. Now, suppose somebody tells you you have to prepare a checklist. Okay. What? Just remember the steps and right. Has the staff done palm to palm, right palm over the left? Was adequate soap taken? Was it cleaned properly? These some points will be there. Okay. Normally you have hand hygiene audits. Okay. So in that you will have. So always remember, when you're making some policy protocol or something like that, make sure don't include too many things. The more you include, you have to follow and make sure that that is followed. So make limited. Some people are there extra perfection, and therefore you will include lot things. This audit and all is very robotic, mechanical. Therefore, the easier, the better for the staff, the better for the audit, and better for you and everybody. Always make sure whenever you make a new protocol or a new checklist, the minimum thing should be included in your checklist. Okay. So that no one has a headache. Then PPE, personal protective equipment. All healthcare professionals should wear specialized clothing or personal protective equipment to protect themselves from exposure to blood or body fluid spills. Okay. Types of PPE, you already know all this: gloves, eye protection, surgical mask, gown, boots. This is the different types of PPE. This looks like a COVID PPE. I don't think so. Everybody wears all these things depending on different conditions. Okay. Now, what are the sequence of wearing PPE? One, boots, then gown, then surgical procedure or mask, then eye, and then last my gloves. Okay, this is wearing PPE, but isme changes will be there. Okay, this is in consideration with OT kind of things. Some places you don't have boot covers, so forget the boot. Then you will start with your gown. Sometimes doctors come outside only with the gown. You are roaming around with the gown, whole hospital with the gown. Now, removing of PPE. How will you remove the PPE? The most dirtiest is the first. Remove boots, then the procedure mask, then you remove your gown. Actually, gloves is the dirtiest. Then you remove the eye, then you remove your gloves. Okay, remove everything in this order. Gloves will be the last actually, because if you remove your gloves first, then you're going to touch your dirty gown, dirty boots, and then you're going to contaminate your hand. So once you remove all this, and last you will remove your gloves, and then you are free of all kinds of infection. Okay, it's clear, everybody. So this much is what we discussed. This is for your first part of. So whenever you're doing an audit, whenever there's an audit, these are the things that is focus in any hospital, wherever you go, whether it's India, abroad, West European countries, Gulf countries, everywhere. Okay. So this is how it happens. Okay. So almost everything, Now what are remaining? The remaining points will be your needle stick injury, then your linen and laundry. There are some more spillage policy. Okay. So these kind of things. So mostly in a already set hospital, they have a very good manual and a protocol. Okay. Your duty will be very simple. You will just have to review these manuals, find out what the new changes. You have to focus on retraining and training. Okay. I have come across people, especially the staff, saying, "She, what is this?" Every time they give this hand hygiene training. You know why they do this? It's not, the topic is so simple. Is there anybody who doesn't know about hand hygiene? But why do you think that every month this training is given? Can you all tell me? He knows about hand hygiene. Every month this training will be given. Why? It's because, why? Not because you need basic thing, and that is why they currently review that. At least then staffs are sensitized that this topic is important. We need to follow it strictly. Okay, so that's one important thing of hand hygiene. Matlab, you do everything for the hospital, the best standards, the best protocol, best PPE, and then you all are not able to protect yourself and protect the patient. Then it's of no use. That's the correct answer. So that's important. Okay, then is, so like I told you, please go through the SOP manual of HIC. It's a request to you all. This is how you will learn. See, if you've paid money and you're doing this infection control course, it should be a benefit for you. Okay, that happens when you grow in knowledge. So open and check what is there in your infection control manual. You'll see lots of new things which you've never heard before, and that only your microbiologist or HIC nurse will know about it. So go through that. Check out the new protocols. This will help you gain more and more knowledge about this particular